Welcome back to Ultra Life Today. I am Josh Bellew. On the end is
Adam Payne,
the CEO and founder of Ultra Botanica. By the way, makers of the curcumin you can feel. It is a unique technology employed that came out of Adam's awesome background with a bunch of cool people at Oklahoma Medical Research Foundation, University of Oklahoma Health Sciences Center. We're smack dab in the middle of Oklahoma City, west of the capital, 25,000 square foot pharma manufacturing facility. And we love interviewing people like Dr. Royce Bargas. It gives us this beautiful opportunity to bring someone in that specializes in a certain area of medical practice, but they do it from a mindset that's very different than the standard of care providers that are everywhere, although she does that as well. So Dr. Bargas, again, thank you so much for being here with us. Welcome to the third segment that we're moving into. So I think we'll end up having 4 segments with you total. So mark that down, people that are listening. And Adam, you had stimulated
just to recap. So this will for most of our listeners, this will be picking up from last week's broadcast.
Right.
So Dr. Bargas, you decided to go into functional medicine because of the disillusionment you were getting with conventional medicine. You had a vision for yourself as a child practicing medicine and helping people to achieve health in their lives. You were faced with the quagmire of current medicine, which is a diagnose and treat modality of find the diagnosis and then treat the symptoms. And you, in your efforts to redefine yourself, you ended up at a hormone conference and you learned about functional medicine, and you decided that this was really the medicine you wanted to practice. So tell us about the how long did you have to study to get certified in functional medicine? Was this like a 6-month endeavor?
It's a weekend workshop and an online thing that you do in 2 days, Adam.
I mean, so give us some context here. So how much effort is really required to get trained in the Fellowship of Functional Medicine?
Right. So through the Institute of Functional Medicine, so there's 2 institutions. One's called A4M, and I forget what all the A's stand for, or all the M's. And then there's the Institute for Functional Medicine, which is how I certified. So it can take up to 5 years, I think, from the time you take your first module until they want you to have taken your certification exam. I think they allow you 5 years. And so you can really go at your own pace. For me, I mean, I had a full-time practice, and so this was just kind of my CME for a couple of years as I would take these courses. So for the Institute for Functional Medicine, you take a 1-week course, which is literally 40 hours.
Wow.
In a classroom, taking this introductory to applying functional medicine in your clinical practice is what it's called. And then there are 6 modules, and the modules are 2.5 days each, and usually they back them back to back, so you can take 5 days together if you want to take these 2 modules. And then IFM provides so much information, it's unbelievable. And so there's all this pre-course content, post-course content, where you're watching these webinars and having access to a lot of information, even when it's not the 2.5 days that you're sitting in the lecture room learning. And then after you're done with all 6 modules, which usually each module is only offered once a year. Yeah, once a year. And so it'll take you a minimum of a year to get through all the modules. Then you start the actual certification process, which involves writing up a very extensive case report where you take a patient from the first time you met them until now and have to really detail all the investigation you did and all the ways that you helped them. And then there's a very hard certification exam that I will tell you, it was harder than my electrophysiology boards.
Wow.
That's impressive.
Yeah, it's pretty difficult because it's really, I mean, it takes you back to first year medical school biochemistry, and you really have to, it's applied biochemistry, which is very difficult for somebody who is really like in the heat of just clinical medicine, and I was very far removed from, first year med school biochemistry.
So you had to dig down deep again.
Yeah, but the interesting thing is that when I was in medical school, I actually tutored cardiac electrophysiology. And this was even before I knew I was going to be a cardiologist, but I just loved like the action potential of the cardiac myocyte and all the channels and how that
interesting.
worked. And so I taught that to other people. So, you know, biochemistry and physiology really is part of who I am. And so it's so concrete. I'm such a black and white person that it wasn't hard for me to turn to that realm to help people.
So a lot of people, when they see that a lot of people that are probably coming to you have either experienced a heart attack or have experienced some sort of cardiovascular pathology, and because normal healthy people are not probably going to walk off the street and say, you know what, I'm going to go see an integrative cardiologist. They're probably coming to you with some functional need, and it's probably not something, and anything that deals with the cardiovascular system. That's the essence of our life, right? Is our cardio function. Mm-hmm. So, this is a preface to a very simple question. A lot of people think that these kinds of cardiovascular issues, either a heart attack or occlusions or some sort of dysrhythmia of the heart, that these are things that are once you have it, you're going to have it for the rest of your life, and there's just no way to overcome them. It's kind of a dead-end diagnosis.
And I have to interrupt, Adam, because what a beautiful setup this was. One of the notes questions that I had for Dr. Bargas, or comment, was right out of the gate on your YouTube channel with your introductory video for your practice, you immediately talk about curing people. And I'm so glad you said what you just said, Adam, because people have a mindset that when they have a problem with their heart, it's forever.
Right, and it's kind of, oh well, I'm at the end of my whatever useful life here. Do you? I want to imagine that you see a patient and you're saying to yourself, I am going to transform you from thinking that you are in an end stage issue to there's a whole new lease on life that we can get for you based upon things that we can do in a functional approach.
Yes.
Is that really possible for people?
Yes, it is. I mean, once you have significant plaque in your coronary artery, thus far, unfortunately, and I hope this changes, there are not a lot of things that cause plaque regression. But a big part of my practice initially, as I develop a relationship with the patient, is to empower them and have them believe that they are not their diagnoses and that their genes are not their destiny. You had asked earlier what testing I do,
That's
and we'll
great.
get into that. But genetic testing can be very powerful and informative, but it's also really important to understand that your genes are not your destiny. You are not that diagnosis that's been written down, that ICD-10 code that you've been given. That is not who you are.
Right.
You were born to be this high-performance machine, and everybody has the capacity to get back to that. So is it only sick people that come to see me? No, thank God. I do see a lot of healthy people because there's this developing mindset that there is a prevention. And obviously, I want to see people before they have disease because I do have a lot more to offer them when I'm trying to prevent something than when I'm trying to prevent the second something, if that makes sense. So I do a lot of prevention. A lot of my education is kind of geared toward prevention and people understanding their risk. Even in my conventional practice, when you have a 15-minute, totally insurance-based appointment with me, if I want to put you on a cholesterol-lowering medication, I'm actually giving you a percentage. I'm calculating your risk based on these sophisticated algorithms that we have developed from decades and decades of research to tell them, this is why I think you should take this.
Right.
Or this is why I don't think that's a good idea for you. And so people need to understand their risk, and they need to know that they can modify that risk.
Right. And I know in the functional medicine approach, there's kind of a triangle of different things that functional doctors tend to focus on. One is kind of autoimmunity. The other is the oxidative stress on the body, and the third part of the triangle is inflammation. do you utilize how do you approach the triangle of functional medicine?
So in the world of IFM training, we don't really have a triangle. We have a hectagon.
A hectagon.
There's two things we left out.
Hectagon, yeah. And so there's actually 7 nodes
Oh,
of your
wow.
functional
Okay.
medicine matrix.
Can you help us understand them?
Oh my gosh, my preceptors
Sorry.
are going to shun me if I can't remember all of them. But basically, we look at energy, so mitochondrial function is incredibly important. We look at inflammation and immunity. That's like one system, and I will tell you that's the most commonly dysfunctional node because as Josh and I were talking, off camera earlier, inflammation is kind of the root of all evil, and that's really kind of the premise of my
Or out of balance
cardiovascular
inflammation,
prevention.
right?
Yeah, and we look at structural issues.
That's good.
Assimilation, which is your ability to absorb and utilize various nutrients.
Oh, that's good.
That's awesome.
We look at communication, which is really just the
Nerve
fancy
conduction?
the functional word for hormones and how messages are transmitted throughout the body from system to system.
That's good.
How many is that?
You hit 6 already.
Oh gosh, what is the other
It's
one?
okay. Even if it is.
Your ability to detox, biotransformation.
Oh,
so
that's
your
beautiful.
ability to detox.
Nice.
So
our
phase
own-
1 and phase 2 detoxification.
and phase 3, which is getting it out of the body.
All right.
Yes.
That's good.
Very good. So this is Ultra Life today. We've actually got several minutes left, about 3.5 before break, guys. But I want you to know you can reach out to Dr. Bargas at bargaswellness.com. And that's BARGAS wellness.com, 10-minute free consultation, newsletter. And thank you again for sharing with all your friends Ultra Life today. Please send this link out, post it on your social media pages, and let's get more people coming in to see Dr. Bargas. Now, Dr. Bargas, with a couple of minutes left, Adam said something that was, again, one of my questions, and I want to see if you can give me a couple of minute response to this. It was only recently for me that the idea of the heart almost having this hierarchy of needs as it relates to organ systems in the body began to be a thought for me. I heard someone say something that was a functional medicine person, and it kind of stimulated my thought, and I thought, I don't really think about my heart, but I've never had any issues, and I eat well and stuff. But where does the heart fit in the hierarchy of needs? If someone comes to you, because you're a cardiologist, you're always going to be looking at the heart, right? But is it really like way up there, like Adam said, as kind of the thing? I mean, obviously, we stop breathing and we go away if it's not
Right, yeah. If it's not functioning optimally, then we're going to have issues, obviously.
In the functional medicine space, Josh, we don't really have a hierarchy.
Okay.
Obviously, if your
Because
heart's
you're-
not beating, you're no longer with us, and
Right.
that's a bad thing. But the body, all the systems of the body are so interconnected,
Yep.
and every organ depends on another one. And I guess you can live without one of your limbs. Those aren't organs, but there's an entire nervous system between the heart and the brain. It's called the heart-brain axis. And I use a lot of that in my practice using Heart Math, which is this proprietary kind of stress resiliency program, which I love it because it's electrophysiology for the soul. And
What?
And
Hold
yeah,
on.
and
Is this a
Yeah,
device?
Keep in mind, we've got a minute left.
Well,
so
we're
this
gonna
will
come
be a
back in the-
beautiful-
yeah, we
I
can
want to
segue.
hear.
Yeah, I wanna hear
I want to
more
ask
about
her
this.
about her toys and some of these software
Yeah, so-
programs
yeah,
she
and you
uses.
had asked about what labs do I use earlier, so we can touch upon that too. After
So
the
let's
break.
let's talk about this after the break. I'm really fascinated to hear some of these stories and some of these toys that you use, because a lot of I find functional medicine doctors, they tend to gravitate to a couple of different devices or toys that they see are transformative in the context of their practice. So I'm Adam Payne.
I am Josh Bellew. We're here with Dr. Royce Bargas, board-certified cardiologist, electrophysiologist, and an integrative and functional medicine practitioner right here in Oklahoma City in the Edmond area. You can reach her at bargaswellness.com. That's B as in boy, ARGAS wellness.com, bargaswellness.com. Call her up, get a free consultation, contact her through her website. Get on her newsletter. You're going to get some great information, and we're going to be back with another segment that's going to rock your socks, because we're going to start talking about toys and case studies and things she has seen. So this is Ultra Life Today. We'll be right back.
Our mission is to take nature's most beloved botanicals and enhance them with our liquid protein scaffold technology. This helps it reach your cells faster and better. With exponentially enhanced bioavailability, you'll feel better every day. Ultra Botanica, the feel-good curcumin.
Welcome back to Ultra Life. Today, I'm one of your hosts, Josh Bell. You're sitting next to
Adam Payne, and we have Dr. Bargas here in between us. We've been having a fascinating discussion about her background, how she actually got into functional medicine. You've educated me. I thought that the pyramid was kind of the epitome of functional medicine, and now there's a heptagon. Heptagon, 7 sides?
7 sides.
7 sides. Wow. You know that number 7 is holy in so many different religions, so maybe that's why we have 7 sides to health. You mentioned right before the break that you have some toys that you have in your practice that
Yes.
you, and I find this over and over again. Every functional doc that we've interviewed, they have something special that they love to play with in their toolkit. So tell us about this heart map, and where did you find it? What does it do? And what does it tell you? What information does it give you to help your patients?
Yes. So I'm going to step back to the heptagon, Adam. And so inside the heptagon is sort of a triangle or like a 3-legged stool.
Okay.
And it's inside because it's our psychological, emotional, and spiritual health.
Oh, interesting.
And it affects every single node of the matrix. And
Yeah.
that's why it's kind of inside in the foundation.
So that's the relationship of the patient to themselves, to the spirituality, and to other people
now.
around
Is
them.
that what you were
Yes.
referring to as the heart brain?
No.
Okay,
but
good, because I
we'll
want to
talk-
get there.
So
I
we'll
wanna
talk
get there.
about. So it's just important to understand that for our physiology to be completely optimal and for us to restore the most natural state of health, we have to come to grips with any trauma, any psychological stress.
Well, that's so important.
Like our mental health is a huge part of that. And a lot of patients want to, sweep their childhood trauma under the table or something and forget about it. They don't want to deal with it. But you will never achieve optimal health if you do not develop resiliency to stress, which will bring me to heart math, and dealing with your mental and spiritual and emotional health.
Wow.
What I think is one of the biggest obstacles for many people in their health is forgiveness. When the people hold grudges or are perseverating on past wrongs that they've experienced, a lot of times that creates a whole slew of health issues because they're holding on to so much anger or pain or trauma, and they're not willing to let it go and to find healing in that area. And you're kind of the first physician I've talked to that has even talked about this spiritual access as being important.
As a core
It is.
of what you do,
It
which
is.
I think
So-
is really cool.
And
So you measure this? Do you have a device that measures this at some level?
Or,
Well,
or
I
some
have
type of
a-
software that allows you to
Okay,
plug in some inputs, or
I can measure. Stress and psychological trauma is inflammatory, and
Oh, interesting.
we haven't even addressed like my 4 pillars of cardiovascular disease. But
then we'll have to have you back.
Oh,
yeah, well, I'll have to come back for that one. But I don't really measure it. But let's talk about heart math, which again is my favorite stress resiliency practice. So what people don't understand is that they have complete control over how the stress in their lives affect their physiology.
Oh,
Stress is
interesting.
inflammatory. It
Boy,
makes
what a
people
statement.
gain weight. It causes diabetes. Stress is very bad for us. But Hans Selye, the guy who determined, he termed stress from physics and how it relates to our lives. I love to quote him when he said, "It's not the stress that kills us, or it's our reaction to it.
it's our response to
It's
stress.
our response
Okay.
to stress." And so what I try to empower all my patients to understand is that they are in control of how it affects their physiology. And so heart math is a very objective, I've said it many times, I'm very black and white. I want objective measurements. I want numbers. I want to be able to help people. And so HeartMath is a technology that uses heart rate variability, which is the beat-to-beat variability in your heart. And you might think that you want that to be very regular, but you don't. You want a very high heart rate variability. And it's a measurement, it's an electrophysiological measurement that is very underappreciated in medicine. It's actually one of the best global predictors of your health.
That's
Your heart rate variability.
incredible.
It's available on your smartwatches now, by the way.
What?
Yes, I have it on my.
Well,
I can give
Adam,
you my score. I can tell you all
I
about it
feel
after
so
the
left
show.
out and shamed. No smartwatch yet.
Yes. So HeartMath uses a device that measures your heart rate variability and measures your coherence. And so physiologic coherence is when all of your systems are in alignment, and if you can put it on paper and measure it, it has like this beautiful sine wave of how we're doing.
Oh,
Well,
interesting.
when we're stressed, that process leads to incoherence. And when you can measure it, it's this jagged, crooked line that's all over the place. And that's how we feel when we're stressed. But we have the ability to turn that incoherence into coherence. And when we do this stress resiliency work and we become more and more coherent in our lives, then as those stressors come at us, they have a much less physiologic effect and a much less power over us to cause disease and dysfunction.
So
in
they
our
might
body.
create an increased heart rate, but it's not a prolonged impact upon our overall well-being over a longer period of time. We can address the stress and then de-escalate it in a way that allows us to address it, but not to be driven by it. Is that what you're saying?
Yes, it allows us to control our physiologic response to stress instead of stress controlling us, which makes us.
So how do you even
Yeah.
approach that with a patient?
Yeah, so it's through the same way you have to go to the gym and exercise every day, you have to take your supplements or medicines every day, you have to do the stress resiliency work every day. And so a lot of people meditate, a lot of people use prayer as their form of meditation. HeartMath is much more objective and scientific than that. And so you wear this sensor and you have an app either on your phone or your computer or your iPad, and you do this focused breath work, and there are 5 or 6 different techniques that you learned through the HeartMath experience on how to modulate your stress response and how to increase coherence. And so it's just something that you have your homework every day, like going to the gym, like how you eat lunch or dinner. I encourage breakfast fasting, by the way. Like it's just on your to-do list every day. And the more you do this, even if it's just for 2 minutes at a time, 5 minutes at a time, 2 to 3 times a day.
So you're throwing down the gauntlet here, right, for us to do something about this.
So, yeah, so
Yeah,
we-
you
What's
have
the
to
app
control your
called?
stress.
What's the app?
It's called HeartMath. Well, HeartMath is the
HeartMath.
company. So heartmath.org, I think, is the
Okay.
website.
All right.
Good to
And
know. Good to
I'll
know.
be having classes at Bargas Wellness soon. Hopefully,
Excellent.
first quarter. Hopefully, I'll be launching those. And
Go to the
and
website, sign up.
The sensor is called Inner Balance, and you can purchase it at HeartMath.
Or you can get it on your iWatch or your Apple Watch.
Well, if you want to do the coherence and resiliency work, you need the sensor
Okay.
to use with the app. Your watch will give you your heart rate variability, and you can do your own mindfulness practice over time and watch your heart rate variability improve. But the key to stress resiliency is to do the work. And nobody wants to do the work. Like just sit and focused breathing twice a day, meditating, doing nothing. People think they're bad meditators. There's no such thing as a bad meditator. And that is how you build resiliency over time.
Interesting.
So that when a stressor comes at you, it's like water off a duck's back. You know what? I'm not going to let that control my life. I'm not going to get a cold over you doing that to me or whatever, because we are in complete control and people don't understand that.
So are some people, Dr. Bargas, naturally just good at this and they don't know it, but would the largest segment of the population does not know how to really, as you said, make stress be like water off a duck's back? I mean,
Oh,
so
there are
it's-
definitely personalities that, I mean, you know these people that never get riled about anything. Like, I suspect, well, maybe not you, Adam. You and I are probably like pretty type A. Like, takes much less to light my fuse than people who aren't type A.
I'm pretty resilient. It takes a lot to get me riled up about something.
Yeah. So there is a certain element of your personality, and is it nature versus nurture?
Well,
it's a
I
lot
also
of both,
my
but-
dad actually invented biofeedback instrumentation in the
my
60s.
gosh.
I was about to introduce
so HeartMath
that.
is a form of biofeedback.
Yeah, so I learned from, I was building biofeedback instruments in my dad's lab in the
That's awesome.
70s. And so I learned how, through biofeedback, I can control my stress levels almost unconsciously. I know how to
That's right.
move into a space of just complete
That's right.
peace
Yeah.
in my inner being. And it's
so
really
HeartMath
beautiful.
teaches you how to do that.
Oh, it's interesting.
basically.
Oh, so
It
it's a
just-
form of biofeedback.
It is a form of biofeedback.
Oh, beautiful.
Absolutely.
Yeah,
You
everybody
do
needs to learn
focused
this.
breath work, and the power of the mind in our physiology is also very underappreciated. And like when you're measuring somebody's coherence and you have them think about the guy who cut them off in traffic last week, it literally like becomes this super jagged line. But then when you're like, well, think about like a time when you've been the happiest in your whole life, or like snuggling on the couch with your favorite pet or something, it just automatically goes into this nice coherent thing.
We used to measure alpha waves and beta waves in the brain because we went beyond just the skin conductivity and things like that. It's so beautiful. I'm grateful you've brought something full circle from my childhood, actually, and things that I learned as a kid into something that's actually back into functional. I forgot about these practices in my own life in some regard.
So with 3 minutes left, I know our listeners love it, Dr. Bargas, when you, obviously anonymously, you take a case study of someone that may have come to you, and you can kind of tell us what they were like in their history, and then, within 3 minutes, take us to that point where you've seen dramatic or transformative changes in their life and health. What you did, what they did. I know it's a big thing for 3 minutes, right?
So Adam asked a while ago what testing I use. So I do this advanced cardiometabolic testing in my office, and people come to me, they've had their lipid panel, right? And so they know their total cholesterol, their good cholesterol, their bad cholesterol, which there's no such thing, by the way, and their triglycerides.
Oh, I love hearing you say that.
And so I do very advanced testing, and I believe that cardiovascular disease, everybody should believe this. It is not just about your LDL, and that's what I tell people too. Your cholesterol is not your density. It's mostly about inflammation, oxidation, insulin resistance.
Yep.
And I do this huge comprehensive panel that I measure all these markers for all of these things, and then I can prevent cardiovascular disease even if your LDL is 180. Because if I get rid of inflammation and I reverse your insulin resistance and you don't have oxidative stress, you will not get cardiovascular disease.
Right. Yeah, the plaque will not embed.
Yeah, I loved, again, your definitive statement of we want to cure you at Bargas Wellness. I'm like, that is so bold, and I love that.
Yeah, so I do this comprehensive testing. So I have a patient, and he has had several strokes, and he has cardiovascular disease, and he was a metabolic disaster when he came to see me. But for whatever reason, at this point in his life, it was like the last straw, the last TIA mini stroke he had had, and he was very motivated to make change.
Nice.
And when I met him, I was like, is this guy really going to do what's necessary? Well, I wish I had his numbers to show you, because his report, through all I did is I put him on some botanicals for cholesterol reduction. Most important, I put him on this whole foods diet. I'll also throw out there that I am not plant-based. People think that you have to be vegan to not get cardiovascular disease, and you do not. So I put him on this whole foods diet, and I gave him an exercise prescription. He had to do stress resiliency work. I treated his sleep apnea. And his lab report 3 months later went from completely red to all green and yellow.
3 months.
In 3 months.
90. days
And that-
to
and-
potentially change the course of that individual's life forever, and their longevity, how long they're on the earth, and how good they feel while they're here,
That's right.
Oh
And
my
the other
gosh.
thing is that he didn't feel the same. He's my favorite patient. I don't have a favorite patient. I'm just kidding. He would,
That was great.
he would call me
Good
like
recovery.
every 2 weeks and be like, Dr. Bargas, you won't believe, like, my joints don't hurt anymore.
Oh, this is awesome.
I had this brain fog that's just suddenly lifted. And then he wants to do all the work, right? And he wants to be compliant, and he wants all of his numbers to be green. And so I just love that story because
Because you looked at him in the beginning like, is this guy really going to do the work?
what you have to do. And there are people that come through my door and they want their pill for their ill. They just don't want it to be a statin or a pharmaceutical.
Right.
But that kind of mentality doesn't work. Like, you have to be willing to make changes in your life. And you can out-eat any pharmaceutical, any nutraceutical, any exercise plan. And you really have to be able to make changes. You have to incorporate movement into your lives, and you have to change what you put in your body.
You've been listening to Dr. Royce Bargas. She's a board-certified cardiologist, electrophysiologist. She's an integrative and functional medicine, has her own practice in Edmond. This lady has just shared with us from this case study. She has the tools, and she can provide you with the roadmap. So there is this action that takes place. Probably one reason she mentioned that being her favorite patient was he actually did the work. But look, in 90 days, the person's life was transformed and changed. You can get a hold of Royce Bargas at bargaswellness.com. That's BARGAS wellness.com. You can get a free newsletter that comes in monthly. You can keep up on events that are going to be taking place at her practice. And it's very simple to get a hold of her and even get a free 10-minute consultation. We so appreciate you coming out. I can already think of 4 more episodes.
Well,
we
yeah,
would love
we
to
got.
do
We
with
need
you.
to learn the 4 pillars of your practice. Don't
the-
share
the,
yet.
The fiery 4.
The
Stay
fiery
tuned.
4. Yeah.
So you've been listening to Ultra Life today. I'm Josh Bellew,
I'm Adam Payne.
and this is Dr. Royce Bargas.
Thanks for joining us.